Hi, I'm Caitlin Macri, and I'm super excited to be applying to the DNP program at UNCW. I have 2 years experience in the ER, and I really look forward to hopefully advancing my career in healthcare. To answer your questions, for question 1, while both the MSN and DNP programs prepare nurses for advanced practice, in my opinion, the DNP goes beyond just the clinical aspect of nursing. It emphasizes leadership, evidence-based practice, and the application of research to practice. It not only gives us nurses the ability to provide direct patient care, but also provides the knowledge to be a leader of change and improve healthcare systems, help influence healthcare policy, and help shape the future of healthcare. Question 2. Working as an ER nurse has greatly influenced my interest in becoming a DNP FNP. In the emergency room, I've cared for patients of all ages, backgrounds, often during critical and stressful moments. I've cared for patients who have seemed to have something very simple going on just for them to become some of my sickest and complex patients. And I wonder what could have been done to prevent this. This has made me realize how important it is to focus more on preventative care, not just reactive care. I want to help these patients stay healthy and avoid crisis before they happen by educating and supporting patients in managing their health proactively. An example I always think of is when I give discharge instructions, I always tell the patients to please follow up with their primary care provider. I can't tell you how many of these patients either say they don't have one or they have not seen one in years. And that's made me realize that something in the healthcare system has to change, and I want to help be a part of that. Question 3. As an ER nurse, I have developed strong critical thinking skills and the ability to stay calm under pressure, which are very essential in managing urgent and complex situations. My experience for caring for patients of all ages, backgrounds, and health conditions has taught me to be adaptable and culturally sensitive. I have also seen how social and environmental factors affect healthcare outcomes, deepening my commitment to providing holistic, patient-centered care. These attributes and experiences have prepared me to become a DNP ready to care for a diverse population across the lifespan. Question 4. One of the most significant long-term goals I've set for myself was to become a registered nurse. That goal did not follow the traditional smooth path. In fact, I actually failed out of my first undergraduate program early on, which was one of the most difficult and humbling experiences of my life. At that time, I was struggling with personal and academic challenges, and I really lacked the focus and discipline needed to succeed. After I took time to reflect, grow, and mature, I decided to come back stronger. I worked to stabilize my personal life, refocus my priorities, and re-enrolled with a renewed sense of purpose. I was no longer trying to earn a degree. I was determined to become a nurse who can make a difference in people's lives. When I got into the ABSN program, that wasn't easy. I had to rebuild my academic record, regain confidence, and prove to myself and others that I was capable. I sought out tutoring when I needed help and learned how to manage my time more effectively. I learned that single failure does not define a person, it's how we respond that matters. Thank you.